The challenge. There is momentum to talk about race as an individual, a community, and a system. People need the foundational understanding of our history to carry forward effective conversations and action to address racial inequities. However, our growth is stunted without having that full knowledge of our history and understanding of systems that impact communities of color. To expand our lens that influences so much the decision-making and shaping of our communities, we need to ensure intentionality in addressing race and health inequities in our policy, our practice, and our culture. The action. Healthy Blue and Louisiana Public Health Institute created the First Annual Symposium on Racial and Health Equity in Louisiana. Over 550 individuals from organizations across Louisiana and beyond joined health equity experts, community leaders, and health professionals to address systemic inequities and build relationships to achieve racial and health equity. The objectives. Momentum. Showcasing the momentum across statewide community partners that are successfully operationalizing efforts that promote health and racial equity. Innovation. Offering ideas, tools, and resources from innovative and emerging practices from partners currently implementing health equity strategies within our community during times of COVID-19 and racial uprising to align efforts for the future equity initiatives. Commitment. Creating action through partnerships, investments, and continued participation in related racial and health equity efforts. The Symposium. The symposium featured Dr. Mindy Fullilove, the professor of urban policy and health at the New School, who shared her thoughts on underpinnings of how social and environmental factors affect the health of communities and how collective action can address these disparities across different sectors.
And what I particularly want to say to you is that we know that things are separate and unequal, but there is another piece to this that is less well understood, and that is that all those policies not only stratify, but they actually break. They have broken our country into small little pieces that are very irritated and they don't like each other. This is a fractured nation. And the task that's really on the table is, how do we repair when we want to build back better? This is what we have to build back. We have to build back the unity of our nation. And maybe we can't even say we have to build it back because we've been segregated for so long that maybe we never had unity. We just weren't as nutty as we are now.
Panelists answered questions and discussed topics including the impact of poverty on community health, the intersection of mental health, the education system, and mass incarceration, and how the healthcare industry can address race-based disparities and access to quality healthcare. Community organizations from around the state submitted videos highlighting their work in the areas of racial and health equity.
It is time for healthcare payers and policymakers to dialogue about race, power, privilege, identity, and social justice. We can no longer ignore these crucial conversations.
Healthy Blue is proud to serve as a catalyst for meaningful transformation within our state at both the healthcare system level and grassroots community level.
I'm hopeful that all of us as a collective, those of us who have been in this work for decades, and those of us who just joined in the journey, can go far together to build a foundation so that every Louisianan has a just and fair opportunity to be healthy and well in their minds, their bodies, and their spirits.
But for most of us here today, health equity is not just a policy priority, it's personal for us. We've seen firsthand both how historical and current harm can translate to earned mistrust in our health system. It's our job to not only acknowledge the mistrust of those who have experienced and lost confidence in the healthcare system that's working for them, but also to do the intentional work of earning that trust back.
Now is the time for us to join together as individuals and organizations to build a collective agenda that acknowledges the deadly impact of institutional racism on our communities. To achieve health equity and create a healthier Louisiana, we must address injustices caused by racism.
U.S. Senator Bill Cassidy, MD, shared his thoughts on COVID-19 and institutional racism.
There is clearly a higher frequency of COVID-19 complications and death among African Americans. We must be concerned that institutional racism plays a role in this.
Dr. Sandra Brown, Dean of Southern University College of Nursing and Allied Health, presented a call to action for Louisiana health equity.
All roads lead to health equity by using an infrastructure that has programmatic structures in place, measurement where we continue to collect data, and implement policy. All three must go hand in hand.
The call to action.
We hope that you found today's session informative. We hope that you go back home with a renewed sense of hope, ready to put ideas into action.
As the symposium ended, LPHI and Healthy Blue announced the creation of a coalition dedicated to ending institutional racism in Louisiana and a series of racial equity learning labs, and invited all to attend the Second Annual Symposium on Racial and Health Equity in Louisiana in 2022.